Hi everyone, this is Aurelie Najm reporting live from Chicago, ACR 2025. I'm from Scotland, Glasgow, by the way. So today is an important day. Today is the day where finally, after many negative studies, we had a positive vagal nerve stimulation trial that was positive. So, what does it take to make a positive trial in vagal nerve stimulation? It takes to implant it inside of the patient. So, a lot of the studies we've seen that were negative were studies with external stimulation. And in this specific case, so that was presented in the RA session, abstract 1675. So, in this specific study, it was an implantable device. And so it was quite interesting. So the study is called Reset RA. They had randomized patients. So everyone had the implantable device placed through surgery, but half of the population, so it was 240 patients in total, half of them had the device turned off for 3 months. And then after 3 months, everyone had the device on, and it was this open label studies that continued for another 66 weeks. So it was really interesting to see that the inclusion criteria was a bit surprising to me because usually you want a DAS calculation that is above 3.2 to define active disease. In this case, it had to be what they call moderate to severe RA, but then it was minimum 4 tender and swollen joints. There was no other criteria, which was fairly surprising to me. But the good thing is the population was already resistant to one biologic at least. And very importantly, in this population, 50% of the people, or actually 30, had not responded inadequately to 2 or more, and 35% had responded inadequately to at least 3 biologic. So we're looking at a resistant population, which is good because these patients are not usually included in trials that much. So primary outcome 3 months ACR 20, so quite soft primary, but even then it seemed to be very efficient. Or at least more efficient than the placebo, the sham control group, which wasn't placebo, 42% versus 19%. And then at 12 months, once people had kind of all gotten to the active group, it was 16% of ACR 70, which, is not that high, but equally, these are people that are mainly resistant to multiple biologics anyways. The good thing as well is that at 12 months, there was no need for rescue therapy or change of biologics in 82% of the people, which again, I think it's a good result. Persistence was good. There was one severe adverse event, though, that was admitted to be related to the implant, and it took that they had to remove it from the patient. But aside from that, there was a question, I think, in the audience about whether or not the sham was an actual sham, because does the patient know if their device is on or off? But aside from that, I think it is promising, but it is invasive. So I think it's definitely a conversation to have with the patient. If we were to develop that, would you want to have this device implanted, considering the improvement is moderate, but it's still better than nothing? So that's something definitely to keep an eye on. And then there's a poster that's presenting the structural data 2614, showing that apparently at 3 months, the active group had less erosions or had less radiographic progression using the MRI RAMRI score. And it was 40% versus 19. So I found that surprising, that so quickly in 3 months you can see such an important difference in the imaging. So I would be quite careful with that one, but definitely something to keep an eye on. The authors explain it by saying that vagal nerve stimulation can reduce rank ligand, which is a pro-osteoclastic cytokine, and therefore reduce bone damage. I think that's seductive, but we need to definitely keep an eye on that and see if that's confirmed in larger studies. That was me for today. Tune on rumnow.com for more content and follow me on Twitter at Aurelie Najm.